Hello, everybody. I have with me today Dr. Jonathan Hodor. Did I pronounce that correctly?
You sure did.
And he is a retired, I hope I'm going to get this right, maternal fetal medicine OBGYN
Correct.
physician. He's a physician. And now he's made a transition to kind of a new type of practice, which he's going to tell us about. Something actually I didn't know much at all about, and I'm really excited to learn more. But what I thought I would start with is just giving you a little bit of background about the kinds of questions that I and all my friends have. So we are, all kind of like mid to late 40s going into 50s. And so often what I hear is, are complaints about weight gain, unexplained weight gain, fatigue, night sweats, all these kind of perimenopausal, menopausal symptoms. And so often people don't seem to know anything about what to do about the symptoms. And so often I also hear complaints that my friends will go to their physicians with these complaints of symptoms, and their physicians don't seem to know anything about what to do. And then there's also this like kind of underlying fear of hormone replacement therapy, because like years ago we were hearing it's bad for you, causes breast cancer, all these kinds of things. So what I would love to know briefly, because I didn't even explain this yet, if you could tell us all about what you actually do now.
Okay.
And how what you do is different from kind of the traditional hormone replacement therapy that we've heard about.
Well, sure. Thank you. And thank you for letting me be a part of this. So our practice, which I'm the medical director of, is a aesthetics and health and regenerative center. And what we focus on, in addition to the standard aesthetic treatments that many people are familiar with, is we're really focusing on men and women's overall health and wellness so that they age into the next period of their lives with a little bit more intention, the way they want to age more productively with less disease. And we go about doing this in part through the utilization of what we like to refer to as bioidentical hormone replacement therapy. So we're all generally pretty familiar with hormone replacement therapy. The classic old way of thinking about hormone replacement therapy was initially targeted just for women, and it was replacing estrogen and progesterone as women reach their menopause or perimenopause and menopausal years. But today, when we talk about hormone replacement therapy, we in our practice like to refer to it as BHRT, or bioidentical replacement therapy, because we're actually replacing not only estradiol in women, progesterone in women, but we're also replacing testosterone in women and in men, because these are the most abundant hormones in men and women throughout our lives, not so much the estrogen and the progesterone for men, but in women that are really beneficial, that are going to help carry them into the future, or their, I like to say this, the part two of their life, 50 and above. So for us, it's really important to clarify to patients or clients that your testosterone as a woman generally starts to decline in your 30s. Mm-hmm. And after that, your progesterone starts to decline. And now you're into your 40s, your testosterone has decreased, your progesterone has decreased, and now you're into your late 40s, your estradiol or estrogen is decreasing. And all of a sudden, all of those key hormones are down to zero, essentially. And now you're in menopause. And now you're all symptomatic with everything that you're asking your doctors about how to treat, how can I, get rid of these symptoms? How can I start feeling better? Well, the goal is, let's replace those values, those hormones that you've now lost, and get them back up to a value that's going to help mitigate or get rid of your symptoms and make you feel better. Just to touch quickly base for men start losing their testosterone levels in their late 30s, and they lose about 2 to 10% per year, as they age, which also contributes to a lot of the symptoms that we'll talk about in a little bit. So we really want to focus on replacing these hormones to make you feel better and intentionally age appropriately. So we use pellets, which are small capsules. They're they're larger than a grain of rice, but smaller than a Tic Tac. And they're placed subcutaneously in fatty tissue, generally in your side or in your hip, depending on how much fatty tissue you have. And these pellets are either come in the form of testosterone or they come in the form of estradiol. And we replace them based on laboratory values, a value that we obtain through labs that you have drawn. And then we calculate the dosing based on those values plus a symptom checklist. You will fill out a form that says, I have all of these symptoms. It's a question and answer. And then based on that, we can actually then calculate what dose you need for testosterone and estradiol. And we replace that. And these pellets generally are implanted over a 3-month period. And they break down, they biodegrade in your system, in your blood, in your fatty tissue with blood circulation to those areas. And over time, they will break down. So you don't take a shot every day. You don't have to use creams. You don't have to put a patch on. So it simplifies your life. Once they're in, they stay in for that period of time. And once you start becoming symptomatic again, we replace them, which generally speaking is about 3 months, 3 to 4 months for women, about 3 months for men. And these pellets, which are really important for you to know, they're all natural, plant-based. They're not synthetic. They come from a 503B certified compounding pharmacy in Richmond, Texas, called Pharmakeo, which is affiliated with the company we get them from called the Vexapel, and they're patented. So they're very, very high quality medications.
Wow, you said a lot. So I have
that was a lot.
No, I noticed several things I wanted to like follow up on as you were talking. First thing I really love what you said is this concept of intentional aging. So this isn't just about eliminating some bothersome symptoms. This is about helping us age the way we want to age, as opposed to what you said to me before we started recording is like, do I want to age like my grandparents? Or do I want to age the way I want to age? And so as someone who is like really paid attention for many years to my health and well-being, and I do all the right stuff, you know, I want to age the best I can. So I think that's like, I love that concept.
Yeah.
The thing I wanted to ask you about, I thought this was interesting, about the way you guys go about doing this. And now I've forgotten exactly. It's the bio what's it called again?
Bioidentical.
Bioidentical, as opposed to just getting a cream, which is what I've heard from most of my friends. And one of the key things I noticed was that you guys also use testosterone, which is not commonly done. Is that correct?
That's correct.
So what are the reasons that we would need testosterone in addition to whatever is in the cream? What are the creams?
Well,
typically?
the creams for women, generally for women who are actually getting testosterone creams, and there are providers out there who do replace testosterone in the form of a cream for their patients, which is, you know, another way to give testosterone. Testosterone comes in a pellet form, it comes in an injection form, it comes in a cream form. It also comes in rapidly dissolving tablets, which are not recommended. But I think the most important thing for women to recognize is that testosterone was the most abundant hormone in their body throughout the majority of their life. Okay. And just like men. And you have that testosterone to help with all of the things that your body needs it to help with. You know, your lean muscle mass, metabolism, blood flow and circulation. These are all really important components of testosterone and the function of testosterone. Testosterone is also very important for women because it converts to estrogen. So it's one of the breakdown products of testosterone, which is why, if you think about why do men not develop osteoporosis, as frequently as women do is because they have testosterone in their circulation in their body for their entire life, which is why we always have a lower risk of bone loss, because we have estrogen in our system that keeps us from getting that bone loss. Whereas women, as I mentioned before, there's this decline as they age, testosterone first, followed by progesterone, followed by estrogen. But to answer your question as to, why, how do we get this, and why don't women get testosterone the way that men, you would typically think men should, is because I don't think people really, or physicians or healthcare providers who haven't spent a lot of time learning about it, because this is not a specific class in medical school or in residency that we study, know about. And testosterone is very important to replace in women. We have to get that hormone level back up to help capture your youth. Creams are great for some women, but overall, they're messy. They don't absorb the way that a pellet will, because you're applying it to your skin tissue. And if you're subjected to other creams or whatnot that go on your skin, if you're putting on clothing and some of the cream gets absorbed into the clothing, if you touch someone and you have the cream on your arms or on the back of your legs, or you rub it somewhere, you don't get a steady absorption like you would typically do with a pellet. So that's why we don't typically recommend creams. And creams have to be applied almost daily. With a pellet, you apply one time in 3 months and you forget about it. So that's just another way. And estradiol, or estrogen, which is something else that a lot of women get, they usually get in the form of a patch or a cream. The patches usually go on their abdomen or on their hip or on the back of their arm, depending on where their doctors ask them to put it. The same thing. They could be messy and they don't get absorbed as well, but they do seem to work for some women. We generally think that this way is the superior method, just from ease of use. And I think people want to have lifestyles that are easy. It's, let's forget about it and move on with our day, as opposed to, oh, I got to wake up in the morning, I got to put my cream on, I got to wake up every third day, I got to replace my patch, I got to change the site. If I had some body oils on, I put the patch on, it falls off, I got to get a new one, my insurance isn't going to cover it,
For the exact same reason I've been a big fan of an IUD, which I've had since kids were born, right? You don't have to think about it. It's just there. It does its job, that's great. So I'm curious. So when we are, approaching this age, perimenopause, menopause, whatever, how do we know when we need to come to you? Like, so for me, I mean, maybe I'm just in denial. I don't really have symptoms yet, but like I said, maybe I'm in denial. So do you kind of wait till you have symptoms, or should I just, like, at a certain age, just come in and get all my levels tested?
Great question. And it's a very common question we get. I think I'm going to start by just addressing what are the most common symptoms that women and then men will experience when their hormone levels start to decline. And a lot of your viewers may have these symptoms just based on their age, but they may not. But in regard to low estrogen, testosterone, and progesterone in women, typically the most common symptoms that women will complain about will be fatigue and lethargy, lack of motivation. They generally have trouble focusing, difficulty remembering things, mood swings, anxiety, depression, insomnia, and night sweats are classic symptoms of menopause and perimenopause. Weight gain and abdominal fat, we hear that all the time, especially I can't get rid of this weight around my belly. I go to the gym 6 days a week. I exercise, I sweat, and I just keep gaining weight. Another things is hair loss. Menopause, right.
The menopause, the pot
what?
belly.
The pot belly.
The menopause.
Oh, the menopause, that's right. Yeah. They also complain of dry skin, crepey skin. They also complain of loss of libido, frequent urinary tract infections, hot flashes, vaginal dryness, night sweats. And a very important one is inflammation, joint pain, and aches. These are really common symptoms associated with a loss of all three of these hormones:
Oh my God.
estrogen, progesterone, and testosterone.
You have a few of those.
Yes,
That list was very extensive. Oh my God. So, and what you were, I don't mean to get you off track because you were going to tell me whether or not we should just test. But one thing you'd mentioned earlier, I just wanted to bring up now, because that long list you gave me, things like, difficulty sleeping, depression, anxiety, all of those things are symptoms for which we could easily get prescribed sleeping pills or antidepressants, or I don't know, we might just like kill ourselves dieting and going to personal trainers or whatever, when what we really need to do is replace our hormones.
Right. And this is key. What we were talking about, you and I were talking about earlier, is that in training, 20, 25 years ago, we were told when a woman comes in with all those symptoms to the GYN clinic and she's got every symptom that you just mentioned, she's going through menopause, but we need to treat her with an antidepressant. So put her on a Prozac, a Wellbutrin, a Celexa, because that's going to treat all those symptoms, because she's depressed, because she's anxious, because she's irritable, and she can't sleep. So all of these symptoms will be treated with this prescription. But she doesn't really have those. She doesn't have that as a disease. That's not her pathology. Her pathology is her hormones are low.
Wow.
And we're not treating the right thing. We're treating a symptom as opposed to the actual causation. And if we just treated the causation and fixed her hormone levels, all of these symptoms would generally go away, and she wouldn't be labeled as depressed, anxious, etc. And we wouldn't be making things worse by putting her on an antidepressant, which is going to further reduce her hormone levels. So that's what we did wrong for so many years. But I think this is important to understand, that I think we mistreated women for so long when it came to hormone replacement therapy. And a lot of that had to do with the big study that was published back in 2002 in Newsweek, the WHI, the Women's Health Initiative, which really scared a lot of healthcare providers and scared the majority of women who read that publication. And unfortunately, the data in the WHI was flawed, and they're actually going back and looking at it and revising it to clarify what they made a mistake. They just lumped all hormones together when it was really just the progestin component of that study that was what really resulted in an increased risk of breast cancer, not the estradiol component of it, which is what we should be replacing in women. But unfortunately, we just assumed that all hormones are bad. We said all hormones are bad. And women for the last 20 plus years have had to live with symptoms of menopause and perimenopause because nobody would prescribe them medication that was beneficial to them.
Wow. So are there any contraindications for hormone replacement therapy at all?
So at this point in time, there's no disease that we really can't, that would be a contraindication to utilizing hormone replacement therapy, testosterone or estradiol. However, what I will say is we generally shy away from treating women who have had active estrogen receptor positive breast cancer and men who have prostate cancer. I do generally recommend that if someone's really going to be an advocate for themselves to get hormone replacement therapy, testosterone or estradiol, progesterone, that they speak to their oncologist first, because, it's very important to remember that we don't want to reactivate a disease that, could potentially be fatal. So we tend to keep away from that. But outside of that, there's nothing else that's going to be a contraindication. But to answer your question that you mentioned earlier, you asked about, is there something that, do we have to study? Do we have to do blood tests, or how do we know should someone come in who doesn't have symptoms?
Right.
what should bring them in. And I do think that when you get to a certain age, if you're not having any of these symptoms, but you really are committed to trying to age healthier, it's not a bad idea to come in and get your hormone levels checked. Your testosterone, your estradiol, et cetera, your FSH, and look at the questions that we have to see, okay, I don't have any symptoms, but maybe I have some of the things that are on your question and answer page. And then I can go ahead and say, okay, well, that might apply to me. But if I look at your hormone values and I say, okay, you're low here, you would benefit from being a little higher on your testosterone. This could help you. We can help mitigate these symptoms. We could reduce the probability of you getting diabetes or hypertension or maybe Alzheimer's and Parkinson's disease as you age by keeping your testosterone levels a little higher, because there is data that supports improved blood flow, especially the microvasculature in our brains, through the use of higher levels of hormones, or at least testosterone. And so that's going to be beneficial for a lot of people as they age. So I think it's important to come in and have that assessed at a certain point in your life.
Sure. Well, as I told you before, I had no idea, about any of this. The knowledge I had was like so old. I was still under the impression that this stuff was not good for us. But now after talking to you, I'm definitely coming in to get everything tested. And yeah, like I told you, I'm such a fan of the intentional aging. I mean, my father died of Alzheimer's. And I've been reading more and more about how you could actually, prevent that. But I was unaware that hormone replacement could be a part of that. So I'm all for it. Yeah.
You asked me a question earlier, and I don't know if we want to address it, but I think it's important, that you wanted to know about women who have IUDs in place. How do they know if they're going into menopause?
Yeah. So, and I was going to leave that out. I mean, because that's maybe not a question a lot of people have, but it comes up for me a lot because, like I said, I've had an IUD for the past 17 years. And I know some people get regular periods with IUDs. I don't. So when I go to the doctor and they ask, when was your last period? I'm like, I don't know. And I kind of like not knowing in some way. I'm like, I'm blissfully unaware, but I would be interested in knowing.
So IUDs, especially Mirena IUDs, are wonderful because you don't get a period. And I think that's, for us, we love women who come in who get hormone replacement therapy who have Mirena IUDs in place, because we don't have to worry about them having any bleeding if they're getting estradiol replaced. But first and foremost, every woman is going to transition through and into menopause differently. There's no one woman has the exact same symptoms. Some women do, some women don't. But you can leave that Mirena IUD in well into menopause. You don't have to take it out just because you're, quote, in menopause. And in actuality, you don't really know if you're truly in menopause when you have an IUD in place unless you actually take it out. Because in order to be defined as having menopause, you have to have no cycle for 12 months. So you have to take the IUD out and now see. If you wind up having bleeding, well, you have to have 12 months of no bleeding, then you are in menopause. In our community, the more experienced gynecologists generally do not routinely check hormone levels. They just go based on symptoms to identify whether a woman is in menopause or are her symptoms related to something else. But one thing that we tend to see a lot more on social media is this whole thing about, I need to get a hormone panel done. And I'm going to rush into my gynecologist and ask him or her for a hormone panel. But there really are no such things as hormone panels that are specifically targeting menopause. You can't just walk in and say, I want a hormone panel. Well, what kind of hormones do you want us to look at? And this isn't defined. So really, if you want to treat your patient, treat her symptoms. Don't necessarily treat a lab test. And as I was saying earlier, that's not the way we should treat people. Don't look at a lab value and say it's normal, because a normal lab value range is just for a set population at a set period of time. So when you look at, testosterone lab values for men, it's defined in a set population between the ages of 19 and 39, 100 men between 19 and 39 years of age who have a BMI less than 30 at one specific moment in time, and this range is normal. There's no such value for women because there's never been any studies to say what's a normal hormone level, testosterone level in women. So we don't really know,
Wow.
so we can't really say yours, but LabCorp gives us a value, or, Quest, and that says this is where you should fall. But by definition, if you're a man and your testosterone level is less than 300, you're considered severely low. If you're a woman and your testosterone level is less than 20, you're considered severely low. And at some point we can address what's the normal range that we want you to be at to feel your best, but that I can address at another time. But I do think it's really important that go based on symptoms, and ask your provider or give us a call.
Unless you're not having any, you think you're not having any, in which case we should probably get it tested anyway.
And then I think if you're interested to see how this may be beneficial for me, it's as simple as getting a blood test and answering a couple of questions on a lab on a requisition. And
yeah, and it may be, like I said, when you went through that whole list, I thought, okay, I'm not having symptoms, but there were a couple of those things that resonated for me. So it may be that, like, there is a symptom there, I'm just not aware, I'm attributing it to something else,
Right.
So I had a question about lifestyle and how that relates to hormones, and how some of the things that you told me about earlier, some of these lifestyle components can really affect our hormones. So what I've noticed with a lot of people is there's this sort of idea that, like, that this hormone thing is just occurring in a vacuum, and that nothing we do is really having an effect on it. So how much does our lifestyle come into play in terms of, like, these symptoms we might be experiencing? And how does lifestyle actually impact the hormone levels themselves?
Great question. Very important question. As I mentioned earlier, just to recap, for men, we see a 2 to 10% decline in testosterone after the age of about 30. For women, we start seeing that decline in your testosterone in your 30s and then 40s, and then obviously it's zero when you go into menopause, followed with progesterone declining as well, then estradiol or estrogen declining as well. But as it relates to lifestyle, the impact is incredible. In order for our bodies to function well, we need to have a balance of our hormones. Okay. Any disruption to this balance can lead to the side effects or the adverse effects that we were talking about. And some of the most important lifestyle habits to consider that contribute to imbalance are things that we participate or may participate with on a daily basis. Poor nutrition and diet. It's very key. Unhealthy diet leads to poor gut health. And this leads to systemic inflammation. And inflammation is one of the root causes of many of our health issues that leads to hormone imbalance. So again, when your gut is disrupted, your body becomes inflamed. When you get inflammation, your hormones become imbalanced. And that imbalance leads to a lot of symptoms people experience. Classic alcohol and caffeine consumption. Too much caffeine increases stress hormones, which promotes poor sleep, changes in appetite, digestion, and energy. Classic. Excess alcohol intake can lead to estrogen excess, which can contribute to poor pancreatic function, insulin resistance, liver disease, anxiety, and malnutrition. And it also reduces your testosterone levels. And you have too much alcohol, reduced libido. So, these are important things for people to remember. Too much alcohol may, disrupt your, desire to participate in having sex. So just something else to think about. Tobacco, for those of us who still smoke, whether it's vaping or classic cigarettes, we know that any and all types of tobacco are harmful to all of our body systems. But tobacco results in decreased fertility by affecting your ability to produce estrogen and testosterone. And we know that excess tobacco also increases your risk for infertility. So very important for younger women who smoke a lot now to think about that if they're planning on having children in the future. Stress, another lifestyle thing that I think in today's day and age, so many of us are dealing with, whether it's work-related, family-related, but stress is very important because it increases your cortisol levels. And cortisol levels leads to anxiety, decreased immunity, weight gain, depression, decreased focus, memory, and concentration. That's really important. And one thing that I think is probably the most important thing that unfortunately is almost going to be nearly impossible for any and all of us to get around are chemicals in society that, we call endocrine disrupting chemicals, EDCs. The classic one is plastic. And everything in our life generally has some type of plastic in it. And plastics, whether they're on your skin or in your body, that you touch with your skin, they're in your medicine cases or on your medicine bottles or on your vitamins, all of these things can disrupt the way your body makes and maintains your hormones. And so it's dramatic. It's almost impossible to avoid. So what we have to remember is everything we do in our life on a daily basis is impacting the way our hormones are functioning. And if our hormones are being depleted or not being produced the way they used to, then we're going to find that we're going to be much more prone to illness and much more prone to chronic disease as we get older. So, think about it. Back 50, 75, 100 years ago, men and women were living, were stronger and healthier than they are today because we didn't have exposure to all the chemicals we're exposed to today. And if you went back, 50 years and measured your mom or your dad's hormone levels at the exact same age that you are today when they were 50 or whatnot, their hormone levels would be so much higher because they weren't exposed to the things that we're exposed to.
That's interesting. So what I noticed about that is, okay, so you're saying lifestyle is hugely important in terms of how it impacts our hormone levels. Right. And then also the other thing I thought about, because I think I can't remember if this was during the recording or not, but I mentioned I've always thought, okay, I'm just going to manage, all of my health with my lifestyle stuff, right? The nutrition, the exercise, all that. But I also noticed, if my hormone levels are low, just because they've naturally declined, I'm still not going to feel my best. I'm not going to be aging as well as I could. And also I might be less likely to do some of the things I need to be doing for my health. Like if I have low energy, I'm not going to necessarily want to go to the gym or, if I'm not sleeping well at night. Sleep is like this huge topic in health and wellness right now. Yes. And so if you're not sleeping well, you feel like crap, and that's, so it all goes together is what I'm trying to say. And I love all that. Yeah. So we're going to wrap this up because I think we've been talking for at least half an hour, but what I'd like to leave everybody with is, how do we find a physician who's actually informed? I guess word of mouth is usually the best way I've found. How do we contact you?
Well, I think for to answer the question, how do you find the physician? I think it's important to ask around and ask your friends who they use, and then ask the opinion of the providers. Call them and find out, do they utilize certain hormone replacement therapy options for their patients, because not every one of them is going to be an advocate for this, and that's okay. We don't all have to agree that there's more than one way to treat a symptom. There's more than one way to treat menopause or perimenopausal symptoms, and we just have to respect everyone's beliefs. As long as we're not harming anybody, then that's key. And again, not everybody's going to agree with what I'm saying, and that's fine. But I do feel that you have to ask around, because there are a lot of providers in our community in the DMV that do utilize hormone replacement therapy the way we do. And then there are a lot who don't. There are a lot of gynecologists who do this in their office through other forms, not necessarily pellets, but some do. But just ask around, and if you are interested, we can help find someone, maybe inquire for your gynecologist for you, or your primary care doctor, or your nurse practitioner, whoever you see. But if you need us to, if you're interested in us speaking with you, we're happy to. You can find us on the in the internet. Our website is rnraesthetics.com or potomacperformance.com.
And I'll put the website in the
Right.
comment section.
Yeah. And feel free to call us anytime. We're a small boutique med spa. We have 2 nurses, and we're very we're more than happy to speak to you anytime, just to make
And
your
I'll just say,
your-
I met you because I was going to see you guys for aesthetic stuff. I mean, I don't mind telling anyone this. I've had Botox with you guys. I've had some filler, like around the lip, and they're all amazing and just kind of fun, cool people to talk to. But now I will be coming to you for hormones as well.
Great. Well, we look forward to seeing you again, Adele.
Okay, have a great day.
Thanks, and I appreciate you taking the time to speak with me.
Absolutely. Thank you
Take
so
care.
much.
Bye-bye.